week I would like to talk about colic in equines. Colic refers to abdominal pain in horses, often caused by gastrointestinal disturbances. It can result from various factors, including gas accumulation, impaction or constipation, intestinal displacement, or strangulation. The severity of colic ranges from mild discomfort to life-threatening conditions that can require surgical intervention. So, due to the horse's unique digestive anatomy and inability to vomit, colic is a leading cause of equine emergency veterinary visits, and the mortality rate is high. Okay, so let's talk about prevention of colic in equines. Ways we can do this is a consistent diet, which provides high forage with fiber, and limiting grain intake is another good one, and introducing dietary changes gradually over time. We also would like to do adequate hydration. This ensures access to clean water to prevent constipation or impactions. Regular exercise helps to maintain gut motility. Deworming and parasite control can also prevent parasite-induced impactions. Routine dental care, which would be a regular floating of teeth, helps prevent poor mastication and subsequent digestive issues. And we'd also like to minimize stress, so avoid sudden environmental or routine changes that can disrupt your horse's digestion. Okay, so some signs of colic that you might see in your horse are pawing, excessive sweating, kicking at their stomach, violently rolling on the ground, stretching, not having an appetite, or a pulse over 60 beats a minute. Okay, so let's talk about diagnostic tests for colic. To confirm colic and determine its cause, veterinarians will usually do a physical exam. They're looking for increased heart rates over 50 beats a minute. They'll also be listening to the abdomen for decreased or absent gut sounds. They'll also be observing pain behaviors, which again would be pawing, rolling, flank watching, things like that. They would do an abdominal ultrasound. This identifies intestinal motility, displacement, or strangulation. And sometimes they can even do an abdominocentesis, which they would be checking fluid analysis in the abdomen. And normal fluid is clear. Cloudy or red tinged fluid suggests severe intestinal compromise. Sometimes they may do a nasogastric intubation, and this is presence of a reflux that suggests an obstruction. Sometimes they'll do a rectal examination for detecting impacts, distension, or displacements. They'll also do blood work, which will consist of lactate and white blood cell counts, and elevated lactates indicate poor tissue fusion. Okay, so treatment of equines. Treatment varies depending on the severity of the case. So medical management for mild to moderate cases would be pain relief, usually given with flunixin maglamine or benamine, and that would be IV administration for inflammation and pain relief. We would also do fluid therapy through IV or nasogastric tube, and it's administered for fluids to correct dehydration and soften impactions. Sometimes, if they're impacted, laxatives are given, which are mineral oils and Epsom salts, and those are administered through the nasogastric tube to relieve impaction, and um, antispasmodic medications such as Buscopan is used for gas colic to relax the intestinal spasms. So surgical intervention is most common for severe cases, and it's required when it involves strangulation, severe impaction, or displacement. And this is usually performed under general anesthesia with intensive postoperative care. So routes of medication administration would be intravenous, IV. Those would be pain relievers, fluids, and antibiotics, and that's for rapid systemic absorption. Nasogastric tubes would be for fluids, mineral oil, and laxatives directly to the stomach to aid with the colic. And sometimes you'll see intramuscular pain injections, but they're less effective than IV. Oral routes are less common due to decreased gut motility. So, by implementing proper management strategies and recognizing early signs of colic, horse owners can reduce the risk of severe cases and improve outcomes. And in this slide, you will see my references that I used for this. And again, if you suspect colic in your horse, contact your veterinary immediately. The sooner the better. Thanks.